Hey, welcome back to Next Paradigm. I'm Alex.
And I'm Zara. We're glad you're here.
In our last episode, we talked about testosterone in men, what it does, why it's been dropping, and how to support it in many different ways, both naturally and with some other interventions. But here's the thing, testosterone isn't just a men's hormone.
Yeah, this surprised even me when I first learned about it. Women make and need testosterone too. It's just usually not something that gets talked about.
Exactly. And even though women have lower levels than men, when it drops, it can have big impact on things like energy, motivation, strength, and even mood.
So, in this episode, we're going to explore how testosterone works in women, what it actually does, how you might feel if it's low, and what you can do about it without jumping to extremes.
Yeah, we're not here to overcomplicate things and make this very clinical. We're just trying to have a conversation that we truly wish more people would be having.
Right. So, if you've been feeling tired, kind of off, or like you've lost a bit of your spark, it's worth learning about this hormone. It might help things make more sense.
All right, let's get right into it.
Okay, so let's start with the basics, because I think when most people hear testosterone, they picture a bodybuilder or something super macho. But testosterone actually plays a big role in women's health too.
Yeah, and here's the thing. Women do make testosterone. It's just in smaller amounts than men. It's produced mainly in the ovaries and adrenal glands. And even though levels are lower, it's still really important for how your body and your mind functions.
So, what exactly does it do? Like, what are the areas it actually touches?
Well, a lot more than people realize. For one, it helps build and maintain lean muscle. That's a huge thing for women, right? We all know that women, as they age, they lose a lot of muscle tone. That doesn't mean bulking up, though. Really means to have enough muscle to move well, feel strong, and stay physically resilient as you age.
That definitely resonates. I know women who are working out, eating well, but still feel weak or like their body composition is changing. And it's frustrating.
Totally. And testosterone also supports energy and mood. It's linked to motivation, drive, and, that get up and go feeling type thing. When levels are low, some women feel kind of a flat or unmotivated feeling, right? And they often chalk it up to burnout or stress, but it really isn't.
Right, it's easy to blame life when you're tired or just not feeling sharp. But sometimes there's a hormone piece in the background.
Exactly. And then there is libido as well. Testosterone plays a huge role in sexual desire and sensitivity. If you notice a drop in your sex drive, or you're not really feeling connected to your body in that way, it could be a big part of the picture.
That's something a lot of women aren't told. We hear about estrogen and progesterone, but testosterone's usually left out of the conversation, even though it affects intimacy, pleasure, and confidence.
And speaking of confidence, there's also a cognitive piece. Testosterone supports brain function in general, but also like memory, focus, and that feeling of being mentally sharp. So when it dips, you might get more brain fog, kind of indecisiveness, not because you're doing something wrong, but because something is truly missing.
And it's not just about the mind either. There's a physical side too: bone density, metabolic health, fat distribution. Testosterone helps maintain strong bones and keeps your metabolism running more efficiently.
Yeah. So if you're feeling weaker, storing fat in different places, or just not bouncing back the way you used to, it could worth looking into this hormone.
So the big takeaway here is testosterone isn't just a male hormone. For women, it's tied to strength, energy, mental clarity, sex drive, and that feeling of being yourself.
Exactly. And if you've been feeling off and can't quite explain it because everything else seems to be normal, this might be one of the reasons why.
All right, so we know now that testosterone matters for women, but how much are we actually working with compared to men?
Good question. On average, women have about 10 times less testosterone than men. But even though the amounts are smaller, it still has a big impact, especially when it starts to drop.
So it's one of those small but mighty kind of hormones.
Yeah, you could definitely say that. Even slight shift can make noticeable difference in how you feel. The thing is, women's testosterone levels peak in early 20s. That's when women usually have the most energy, drive, physical strength, pretty much all of it.
And then it starts to dip?
Yeah, gradually, but most women will see a slow decline through the 30s, then the 40s, and there's a steeper drop after menopause, especially if ovaries are removed or stop functioning.
And where is testosterone actually made in women?
It's mostly produced in ovaries and adrenal glands. So if there is anything off with either, like chronic stress affecting the adrenals or changes from birth control, pregnancy, or menopause affecting the ovaries, it can lower your testosterone.
So if you're in your 30s or 40s and you're noticing changes like lower energy or less interest in intimacy, it could be more than just getting older.
Absolutely. We tend to normalize these symptoms as just part of life, you kind of aging. But in many cases, they're connected to hormonal shifts. And testosterone is one of those hormones that flies under the radar in our society when it concerns women.
So now that we know what testosterone does in the body and how much we actually have, let's talk about what happens when it starts to dip. What should women be looking out for?
Well, one of the big ones, and the one that actually gets noticed first, is low libido. If sex drive has dropped off, or if arousal just feels just like hard to get to, it can be definitely linked to low testosterone.
And sometimes it's not even about desire. It's also that orgasms feel less intense, or harder to reach, or just kind of flat.
Exactly. Testosterone plays a big role in sexual function and sensation in general, so that's often one of the first signs.
Another one I'll hear a lot is women saying they just don't feel strong anymore. Like they're working out, but they're losing muscle or gaining weight in places they never used to.
Exactly. That's because testosterone helps build and maintain lean muscle. When levels drop, women often see muscle tone decrease and fat increase, especially around the belly and the hips.
And let's talk about energy, because a lot of women I know describe this kind of low grade, all the time fatigue. They're sleeping okay, they're not sick, but they just feel drained.
Right. Persistent fatigue or feeling like you don't recover well after workouts or even stressful days, really, that can be tied to low testosterone as well. It's often brushed off as just life, but obviously there's more to it.
Then there's the mental side. Brain fog, lack of motivation, this kind of blah feeling where you're not necessarily sad, just kind of flat.
Yeah, testosterone helps with focus and drive. And when it's low, you might feel less stressed in things you used to love, or, or like you might feel less interested in things you used to love, or even struggle to make decisions and follow through with things.
And it can sneak into emotional health too, right? Like increased anxiety, irritability, or even this underlying sense of restlessness.
You got it. Yeah. Hormones are chemical messengers, and testosterone is one that supports emotional stability and confidence. When it drops, some women feel more on edge and less grounded.
Another thing I want to mention, vaginal dryness. It's not talked about enough, but it really affects quality of life and intimacy. And again, people assume it's just aging or low estrogen, but testosterone plays a role there too.
Totally. And sometimes women will also experience joint pain or bone density issues. It might seem unrelated, but testosterone helps support bone and joint health as well.
If you're listening to this and thinking, that's me, you're not alone. And more importantly, this isn't just stress or aging. These are real, measurable hormonal changes, and they're worth looking into.
Exactly. It's empowering to know that there is something you can do about it, really. That's the whole point of why we're talking about it. The signs aren't just random, and your body is essentially giving you feedback.
So we've gone over what testosterone does and what it looks like when it's low. Now let's talk about the big question. Why is this happening? What's actually causing testosterone levels to drop in so many women?
Well, there's few layers here, but one of the biggest causes is chronic stress. We've talked about it before. When your body is under pressure for long periods of time, whether it's emotional, physical, or even just ongoing low level stress, it can start prioritizing stress hormones like cortisol instead of testosterone. When that happens, testosterone production often gets pushed to the side and cortisol gets priority.
We actually talked about this in our last episode on men's testosterone, this idea of pregnenolone steal. And it applies to women too, right?
You got it. Yes, absolutely. Pregnenolone is basically the mother hormone that other hormones are made from. And your body uses it to basically make different hormones like cortisol, estrogen, progesterone, and testosterone. But when the stress is high, your body essentially says, you know what, we've got bigger problems. Let's reroute that pregnenolone into making more cortisol instead, which is like an alarm kind of hormone, right? Like we need to do something instead of supporting sex hormones.
So it's not that your body can't make testosterone, it's that it's choosing to make something else based on how stressed you are.
Yep. It's essentially biology doing triage, right? So, that's one of the big reasons women feel that slow creeping burnout because the very hormones that make you feel strong, focused, and energized are being deprioritized.
And stress doesn't always look dramatic either. It could just be feeling constantly rushed, under pressure, overstimulated, or like you never get proper rest.
Absolutely. And that leads us to another cause overtraining and undereating. A lot of women are trying to be healthy, but they're pushing their bodies too hard. There is such a thing as too much cardio, not enough food, not enough rest.
Especially with fasting, cutting carbs, or doing back to back workouts. It's easy to go overboard without meaning to.
Exactly. And the body reads that as stress as well. Like it doesn't know the difference where the stress is coming from. If it doesn't have enough energy coming in, or it feels like it's constantly in survival mode, it downregulates things like testosterone and other hormones. It's the body's way to basically trying to conserve resources.
And then there's hormonal birth control, which I think a lot of people don't realize can affect testosterone too.
Right. Certain birth control methods, like the pill, increase something that's called SHBG, or sex hormone binding globulin. And that essentially what it does, it just grabs onto testosterone molecules and make it inactive, right? So it kind of steals testosterone. So if your total levels look okay on a lab test, but the amount your body can actually use could be low because of SHBG.
Then you've got postpartum shifts. After pregnancy, it's like your whole system goes through a reset. And for some women, testosterone doesn't really bounce back.
Yeah, especially if you layer in sleep deprivation, with the newborn, that's very, very common. Not common, it's pretty much a must. Nutrient depletion and just a huge physical demand of motherhood, right? It's a hard job. That combination can keep testosterone suppressed for a very long time.
And of course, there's perimenopause and menopause. That's when hormone levels start shifting more dramatically.
Yeah, you got it. Ovarian testosterone production naturally slows down during those phases. And unless your adrenal glands are really, really healthy, which a lot of ours are not, and well supported, they may not be able to pick up the slack.
What about nutrients? Are there certain deficiencies that make a difference?
Absolutely. A common one is zinc, for example, or magnesium. We're all pretty much deficient in both of those. Vitamin D is a huge one, and cholesterol, believe it or not, it is a building block for hormone production, right? So if you don't have enough, what's going to happen is that your hormone production is not going to work very efficiently. And If essentially, you can think of it as if your body doesn't have enough raw materials, it can't make what it needs.
And sleep. This always comes up because it's huge. Most testosterone is made during deep sleep, especially in REM cycles. If your sleep is short, broken, or inconsistent, it's one of the fastest ways to mess with your hormone production.
Most testosterone is made during sleep, right? So, especially REM cycles, if your sleep is short, broken, or inconsistent, it's one of the fastest way to mess up your hormone production. And it's very common for a lot of women, both women and men.
And the last one we should touch on is PCOS. That's kind of a unique case, right?
Yeah, PCOS is an interesting kind of topic because it often shows a high testosterone on labs, but it's usually not functioning properly. There is often, insulin resistance, inflammation, imbalanced hormone conversion. So even though levels are elevated, it doesn't necessarily mean you're feeling the benefits of it.
So whether testosterone is low, high, or just not being used properly, there's still a hormonal imbalance at play.
You got it. And that's why we always say you should test, don't guess. Okay, we're going to do a very quick break to thank our sponsors, Odin Labs. If you're struggling with health issues and kind of can't figure it out on your own, we highly recommend making a free consultation appointment with Odin Labs. They specialize in restoring energy and making a shift with your health if you're feeling stuck. So you can reach them at odinhealthlab.com, ODIN healthlab.com.
All right, so let's say you're listening to all this and thinking, okay, maybe this is me. What's the next step? How do you actually find out if your testosterone is low?
That's a great question. Well, the first step is, like we always say, you need to get tested. But this is where it gets a little tricky. Testing testosterone in women is very different than in men. Levels are much lower and ranges are tighter. And most standard labs are based on population averages, right? That's very different than what actually feels optimal for you. So, are the standard tests 100% accurate when it comes for women? That's very debatable.
Yeah, I've definitely heard women say they were told everything is normal, but they still feel exhausted, foggy, or just off.
Exactly. That's because normal doesn't always mean healthy. It just means that the results fall within the average range of everyone who's been tested, including people who might not be thriving themselves.
So, what does functional mean in this context?
Well, functional ranges look at what levels are associated with feeling well, right? Not just avoiding disease. For example, your lab might say free testosterone is normal at 1.5. But many functional practitioners would say a woman feels best between 2.5 and 4.5. That's, almost double or triple the normal range, right? Depending on the age and other factors, of course.
So, there's this gap between surviving and actually functioning well.
Exactly. And the same goes for other markers like DHEA, SHBG. You could be within the lab's normal range, but still have symptoms because your levels aren't optimal for you specifically.
Which is why symptoms matter just as much as the numbers.
Totally. Labs are just part of the picture. You also need to look at how you feel. If you feel tired, foggy, low libido, low mood, if that's the case, and your testosterone is on the lower end of normal range, it might not be optimal for you, even if your report says it's fine, right? Like it's within the range.
Okay, so for someone going to their doctor, what should they actually ask to have tested?
Well, really, there's four key labs that should be looked at. So total testosterone, like this kind of overall amount in your system. Free testosterone, that's the portion of what your body can actually use, right? So bioavailable and actually active in your body. GHEAS gives insight in kind of your body's raw hormone production. SHBG, like we talked about, the sex hormone binding globulin, this protein binds to testosterone and reduces how much is available to use. So too high, less free testosterone.
And for timing, you want to test in the morning?
Yeah, between 7 and 10 a.m. is best on being fasted. And if you're cycling, try to get day 3 to 5 of your menstrual cycle early in the follicular phase. That's when the hormone levels are the most stable, right? So basically in the first part of your cycle, that's kind of what we're trying to say. That's when the hormones are most stable and least affected by ovulation or luteal phases when they shift.
And if someone wants more detailed info?
You can absolutely do that. And there's other tests, like a Dutch test, for example, which shows how your body metabolizes hormones. And there's like saliva panels for cortisol rhythm, but testosterone specifically, blood work, and interpret it in a functional manner is usually the best place to start.
So to sum it up, don't just accept normal if you still feel off. Look for optimal and listen to your symptoms.
Yeah, exactly. You don't need to be at the rock bottom of the lab chart for your experience to be real, right? Like and worth addressing. That's what we're trying to say.
Okay, so now that we've talked about how to test and what to look for, let's move into the practical stuff. What are some natural ways women can support their testosterone levels?
Okay, and even before we dive into this topic, I want to make a quick reference back to our last episodes for men, right? So we talked about, lifting heavy, getting the sun, avoiding seed oils, using red light therapy. Lots of great stuff, right? But the truth is, some of these strategies apply to women, but other ones do not, right? For women, it's not all about kind of like intensity, right? There's different strategies that work really well for women.
Yeah, I remember. It was very leg day builds men, and a few minutes of red light on the crown jewels.
Yep, exactly. With women, it's a little bit more nuanced, partly because of cyclical nature of female hormones, and partly because the goal isn't to push testosterone as high as possible, but to support balance.
Okay, so where do you start?
Okay, so for women, I would start with nutrition first. One of the biggest things women can do is make sure they're eating enough healthy fat and cholesterol. That's what your body uses to make hormones, including testosterone. So essentially, you want to pay attention to foods like whole eggs, grass fed butter, olive oil, avocado, red meat, if it sits well with your body.
And that's something a lot of women avoid, especially if they've been stuck in low fat or dieting mindsets.
Yeah, absolutely. The truth is that too little fat or too few calories overall can actually lower your hormone production. Because essentially, what happens, right, is that when you don't have enough either calories or fat, your body prioritizes cortisol production instead of testosterone production, right? Because it's a stress response. It goes, hey, I don't have enough energy, so I need more energy. I'm going to use cortisol in order to signal my body to use other stores of energy in the body, like muscle, right? Like it would convert muscle to sugar essentially. Which leads us to the second point. Don't over restrict, right? We shouldn't do these prolonged calorie restrictions or prolonged like diets, right? Too much of fasting, under eating, or cutting carbs too aggressively can signal your body that it's not safe to reproduce, right? Which essentially shuts down your testosterone production.
This is especially important for active women who might be training a lot but not eating enough to support recovery.
Yes, exactly. Here we go. And that's the next piece, resistance training, right? Just like in men, strength training is really beneficial for testosterone, but it doesn't need to be heavy powerlifting, right? Things like body weight strength circuits like kettlebells or resistance bands, movements that challenge your muscles and signal strength to your system. That's what you need to prioritize.
So it's more about consistency than intensity.
Right. And you can layer that with cycle syncing. right? So you adjust your workouts depending on where you are in your menstrual cycle. That approach helps reduce stress and gets better results without pushing your body too hard when it's really not primed for it.
And what about stress? We talked earlier about cortisol hijacking testosterone production. How do you work on that?
Well, you can use things like adaptogens, for example. Herbs like ashwagandha or rhodiola, they help regulate stress response and support adrenal functions, which takes some of the pressure off your hormone system. Other simple tools like breathwork meditation or even better sleep can all make a huge difference.
And let's talk about sleep, because I think it's still underrated and it's one of the easiest things to neglect.
Absolutely. And also hack, right? So if you are able to get like 7.5 to 9 hours of sleep and focus on getting some morning sunlight, that sets your circadian rhythm and helps your body know when to make hormones, right? So that's kind of what we don't realize sleep. It's not just about rest, it's also about making hormones. A regular bedtime, less screen time before sleep, and a dark, cool room can make a huge difference in testosterone production overnight.
What about nutrients? Are there specific ones to focus on?
Absolutely. So we'd already talked about some of them, right? So zinc, B vitamins, magnesium, vitamin D, of course. They're the key hormonal signaling kind of minerals. You can get them from food, of course, like pumpkin seeds, leafy greens, eggs, seafood. But supplements are available as well if you need them.
Okay, so we've talked food, stress, sleep, and movement. What about those herbal tools for libido and energy?
For sure, yes. For women specifically, herbs like maca and shatavari can be very helpful. Maca is an adaptogen that supports libido, energy, and mood. Shatavari is a traditional Ayurvedic herb that helps balance female hormones, especially during times of transition like postpartum or premenopause.
And what about red light therapy? Is that just for men?
No, not at all. Women can use red light therapy as well, just in different areas, obviously. For women, applying it to the inner thigh or lower abdomen can support circulation and hormone balance. It's subtle but effective when used consistently. Think of it, you need like 10, 15 minutes a few times per week.
To wrap this up, you don't need to do everything at once. Just start with 1 or 2 small shifts. Eat more whole food fats, lift something a few times a week, cut back on overstressing, and build from there.
Exactly. It's not about fixing everything overnight. It's about creating a condition for your body to basically do all of this stuff naturally.
All right, so we've covered a lot of natural strategies to support testosterone. But what happens when those things aren't enough? When should someone start thinking about hormone therapy?
Yeah, that's a super important question. And the short answer is when symptoms are really affecting your quality of life and you've tried all these other things and it didn't work. And, your labs confirm that your testosterone levels are generally low. So that's kind of when you start thinking of hormone therapy.
And this tends to come up most around menopause, right?
Yeah, a common time for women to consider bioidentical hormone therapy is postmenopause, when ovaries significantly slow down hormone production. But honestly, you need to think about it based on your situation, right? Like it could be something like women who've gone through surgical menopause, right? Like a hysterectomy. At the end of the day, if you having the symptoms, you need to test the levels and basically kind of make a decision from there.
But it's not just about age. What are some of the signs that might push someone to consider therapy?
Yeah, if you've been dealing with kind of ongoing fatigue, low libido, flat mood, brain fog, and your tests show very low testosterone despite doing everything right, then hormone therapy might be a good tool worth looking into.
So let's talk about how it actually works. What are the ways women can take testosterone?
Well, there's few options. Of course, all of them use bioidentical testosterone, which means it's structurally the same as your body's, natural testosterone that it produces. The most common forms are kind of creams or gels. They applied to skin directly. They allow for more kind of smaller and precise dosing. Trotches or lozenges is another one. They dissolve under your tongue and deliver hormones through mucous membranes. Pellets is another one where they implant it under the skin and you have them for several months. They release hormones steadily, but you can't really adjust the dose until the kind of like several months from there, right? So it's a little bit more difficult to deal with.
So compared to men, the doses are much lower.
Exactly. Women need a fraction of what men use, usually just a few milligrams per day. That's why it's really important to work with a practitioner who knows how to dose it appropriately for women specifically.
Exactly. Getting the dose right can make all the difference and help avoid side effects. What are some of the risks or side effects women should know about?
Good question. When testosterone is dosed high or too high and not monitored properly, you might see things like acne, mood swings, or increased facial hair. These are side effects that are usually dose related and often corrected by just adjusting the amount or the delivery method.
So again, it's not something to DIY or guess your way through.
Definitely not. You might want to talk to a hormone literate practitioner, someone who understands how women's hormones function, who looks at your full lab panel and who checks it regularly to see kind of like how did the results correlate to how you're feeling. Monitoring is key. You'll want to check your labs every few months and adjust based on symptoms, not just numbers.
So for anyone listening who's tried the natural route and is still feeling off, it's okay to consider hormone therapy. It's not a failure. It's just another tool.
You got it. Bioidentical therapy, when used carefully and in the right context, can be life changing for women. It's about restoring balance, not pushing numbers for the sake of it.
So before we wrap, I want to zoom out a little. Because this isn't just about hormone levels or lab ranges, it's also about how we think about testosterone in women and how that's shaped by culture.
Absolutely. Testosterone has been branded as a male hormone for a very long time. And when women hear they have it or need more of it, really, there is kind of a subtle stigma. It's like it's going to make you more aggressive or less feminine or somehow too much.
Right. And for a lot of women, especially those raised to be polite, accommodating, or selfless, the idea of boosting something that fuels drive, sexuality, or even boundaries can feel uncomfortable.
Yeah, but that's the misconception. Healthy testosterone in women isn't about becoming hard or hyper competitive. It's about becoming energized, clear, grounded, and embodied. It's about reconnecting with your true self, your voice, your vitality, and your sense of forward motion.
Let's paint that picture, because I think it helps. A woman with healthy testosterone probably isn't thinking about it all the time. She's just moving through her life with a kind of quiet momentum.
Yeah, she wakes up feeling rested, maybe even a little excited about the day. She feels strong in her body, not just like in a six pack kind of way, but she can lift groceries without pain and walk into a room without shrinking.
Her brain is clearer. She makes decisions without second guessing herself so much. She's not constantly running on willpower. She just has more natural fuel in the tank.
And her libido isn't just back, it's responsive. She feels connected to her body, to pleasure, and to desire. In a way, it feels authentic.
That's such a shift from how a lot of women feel when testosterone is low, when everything feels like a chore, when there's less joy, less fire, less connection to who they used to be.
Exactly. That's why this conversation matters so much because when we give women permission to consider testosterone as part of their health, not something to be afraid of, it opens up a door to better energy, better relationships, better aging, really.
It's not about being more masculine. It's about being fully expressed, as the version of yourself that isn't running on empty.
And when more women are supported in that, it changes more than individual lives. It changes communities, families, workplaces. There's a real ripple effect in this.
All right, if you've made it this far, First of all, thank you. This conversation isn't always easy or obvious, and for many women, it's the first time they're hearing that testosterone even matters.
And that's exactly why we're doing this, because low testosterone isn't just a man's issue, it's a human issue. And for women, the signs are often quieter, more layered, and more easily dismissed.
But you don't have to ignore how you feel. If you've been struggling with energy, drive, intimacy, focus, or just not feeling like yourself, this is a signal, not a flaw.
And so here's our ask: test, track, and take action. You don't need to wait until things are bad enough. The earlier you tune in, the easier it is to rebalance and feel more like you again.
And if you want support, you don't have to do this alone. The sponsor of this show, Odin Health Labs, is offering a free consultation to help you review your labs, spot the gaps, and create a personalized hormone support plan.
And they take a functional bioenergetic approach to this. So it's not about all about chasing numbers, it's about building real vitality. You can book a free consult at odinhealthlab.com. That's ODIN healthlab.com.
And if you haven't yet, make sure to subscribe to this podcast. It helps more women hear messages like this, and it means you won't miss what we've got coming next.
Thanks for being here. Thanks for thinking bigger and for being part of this new wave of empowered women's health.
This is Next Paradigm. We'll see you next time.
All right. Thanks a lot, guys.